Okay, we're going to discuss the facial muscle today. What's so important about the facial muscle? Uh, Usually, the facial muscle, this what represents you, your feeling, your reaction. That's why it's really important to know the facial muscle. Just let me be honest with you, and this is for the biology 150 class at College of Staten Island, New York. I understand this will be a lot of muscle in one lab, but I'm going to divide it into two sessions, and at the same time I'm going to ask you just to focus on those important muscle and usually the muscle actions. Origin and insertion is important, but I'm not expecting you to memorize all of them. Only the one actually will be focusing on for the exam, and I'm going to tell you which one actually usually have a lot of questions at the exam as well, especially the department final. Facial muscle is very important, like show your reaction. Here, as you can see right here, this is that will be the superficial layer, and this will be the deep layer of the facial muscle. Of course, if this is the right side of the face, this will be the left side. Okay, so let me just switch this pen because I will need more. Okay, so let's say the first one, like in the frontal here, like in your like forehead in the frontal, you found like epicranius. This is like epicranius frontal belly. As we discussed before, whenever you hear frontal, you expect posterior or inferior, right? In this case will be like the occipital belly, epicranius occipital belly at the back of your skull here, this image in your left side here. So epi, as you know, epithelium, epi would be upon, the most outer one, or upon, right? Like covering something, you cover something from outside. Epicranius, cranium will be the anything to do with the skull or the head, the brain. So epicranius, this muscle actually that covers the frontal of your, the front of your forehead here. Of course, this is cause the wrinkles. When you lift your eyebrow, this is actually cause wrinkles in this area, which a lot of people doesn't like, and usually they inject Botox, which preventing them from doing this, which is really, I don't understand why. But anyway, this is the epicranius frontal belly, and this one will be the epicranius occipital belly. Between them, you found this like silver highway here, or tissues that connect between them or separate between frontal belly and occipital belly. We call this glea aponeurotica or broad epicranial aponeurosis. And as you know, aponeurosis will be this kind of sheath that separate between muscles. So consider this as the highway between the frontal belly and the occipital belly. You go down a little bit here, you're gonna find very nice muscle called orbicularis oculi. So orbicularis coming from orbit, right? You know what the orbit is. So usually orbit, this is something goes circular, like the galaxies, the earth, the sun. So orbicularis oculi come from ocular. If you remember the macroscope, we have the ocular, the eye of the macroscope. So the meaning of this muscle will be the muscle actually surrounding your eye. Okay, and of course this is like responsible for closing your eye as blinking, etc. So if you go down a little bit, you're gonna find another one called orbicularis oris. So same meaning, muscle actually that surround your mouth, and it's this is actually responsible for kissing. Anyway, so yeah, so this is actually muscles surround your mouth, muscles surround your eye. So orbicularis oculi and orbicularis oris from oral test. That's mean that the test you take like when you talk, right? So orbicularis oris and orbicularis oculi. We're gonna find like another nice muscle here, down here, called risorius. This risorius muscle here, this is at the angle of your mouse. Okay, so it's gonna pull your mouse to the side like this. Okay, another two muscle, very important muscle called zygomaticus minor. So once you hear minor again, you know, as we discussed before, you expect major all the time. So you have one zygomaticus minor, it's right here. Minor mean will be the small one or the baby one. And the zygomaticus major will be this one here, the big one right here. Okay. And the another muscle, if you go to the top a little bit, you're gonna find muscle called levator labii superioris. So you don't just get intimidated with those names. If you add E here, you can tell right away the function of this specific muscle. So if you say elevator, what the elevator does is actually bring you up, right, from first floor to 10th floor. Same thing, this is will be bringing the labii or the lips up. So elevator or levator labii superioris. Okay, I usually recommend them when I add E here, but you don't have to, of course. Okay, another muscle that cover the mantle and your chin. This is cover the hyoid bone and all the suprahyoid, infrahyoid muscle here. This is called platysma, the platysma. Another muscle here, you can tell right away. This is depressor labii inferiors. Depressor labii inferiors. So what the action of this muscle? If this muscle elevates and it's superioris or superior, this muscle depresses. So this one pull up, this is one pull down. Okay, it depresses the lips. Beautiful. Muscle at the cover the nose called nasalis. Nasalis. You just if you add lis to the bone, this is meaning the muscle that cover this particular bone. Same thing if you add cus at the end of the bone name, it will be the muscle that cover this particular bone, like zygomaticus minor and zygomaticus major. So nasalis, this is actually responsible for widening your nose nostril. Okay, and if we go to the deep layer right here, we're going to find the masseter. Masseter, very important muscle of mastication. That's when you grind the food. Usually you're gonna find most of the muscle that grinding the food attached to the mandible on the side. So this is a masseter. Okay, and this muscle called levator, again levator anguli oris. You're all expert now. So you tell me what the muscle action will be here. That means this is the muscle elevate the angle of the mouse. Okay, and we have nasalis masseter, elevator anguli oris, and we have the mentalis muscle cut called mentalis. You know this part of the bone called mantle, right? So mentalis, again you add lis, that's mean the muscle that cover this specific bone. This is going to take us to how actually we name the muscle. Just quickly, usually you name the muscle by the bone attached to the muscle. You only add us as zygomaticus, cus, I'm sorry. You add is or lis at the end, like nasalis, right? Sometimes you name the muscle based on the action. So for example, when we discuss the arm, for example, this is like elevator, for example, that's elevate anguli oris, Or in the arm, you have like flexor digitorum. That's mean the muscle actually flexes your digit or your digit, okay, or your fingers. Or extensor. So know that this muscle actually extend your fingers, etc. So based on the action, based on the bone attachment, based on the muscle action, sometimes you name it based in the shape of the muscle itself. Example would be the deltoid. We're going to come to this like next slide. Deltoid looked like delta, so looks like triangle. Or trapezius, like trapezoid. This will be the back of your neck and your shoulder. So the other category actually will be the direction of the muscle fiber, and you're going to find this clear at the abdominal muscle. So abdominal muscle, if they tell you rectus abdominis, that's mean the muscle fiber goes straight up like this. Okay, and if it's tell you external oblique, that's mean the muscle fiber is tilted oblique, it's not straight. And transverse abdominis, your muscle fibers goes like this, like in a transverse plane. Okay, so when you hear rectus mean the muscle fiber go like straight. Okay, like this. We have rectus abdominis and we have rectus femoris. This is in your thigh. We're gonna discuss this later. So sometimes you name the bone based on the muscle. I'm sorry, based on the bone. In this case, it will be like zygomaticus. You have the zygomatic bone here. So you get a zygomaticus minor, this muscle that covers the zygomatic bone. Nasalis here, the muscle that covers the nose. Sometimes the bone attachment. Bone attachment will be example of like this nice muscle here. If you look at this image here, this is sternocleidomastoid. That means muscle attached to the sternum. Clavicle. And mastoid would be the mastoid process here at the end of the mandible and the temporal bone, the skull. This is called mastoid. Mastoid mean in the Latin language, mastoid mean breast. Okay, and this muscle actually responsible for extending and rotating your head. And this very famous muscle has a lot of clinical effects, especially those people who wake up in the morning, you cannot turn your head right and left because of mastoid, sternocleidomastoid sprain or strain. Sometimes you couldn't actually perform the full range of motion. Okay, so this actually some criteria that you name the muscle based on location, bone attachment, and you sometimes the bone itself you add CUS or LIS to know that this bone, this muscle cover this particular bone. Sometimes based on the bone attachment itself, like sternocleidomastoid, sternum, clavicle, and goes to the mastoid process at the side of the back of the head here. And sometimes based on the muscle action, extensor, flexor, or flexor. This tells you this particular muscle perform this action in this specific bone. Sometimes the shape of the muscle itself, like deltoid or trapezius or trapezoid, like the trapezius muscle at the back of your upper cervical and upper shoulder from the back posteriorly. And rectus, or the shape or the direction of the muscle fiber. Rectus means go straight. And oblique, external oblique muscle, that means the muscle fiber is tilted. Or transversus abdominis, this means the muscle fiber go in the transverse. Okay, and just one last muscle here called buccinator. This actually, when you whistle, this muscle actually depresses the side of your cheek here, this area. Okay, called the buccinator. Okay, so yeah, this is just introduction. I don't want you to get confused or anything, but facial expression by far one of the most important muscles because this actually what represents you. Of course, some people has the ability of hiding their facial expression. We call them mask face. Usually it's require a lot of talent to do this. The other thing, there is a lot of like cases, injury like in the facial nerve, for example, people when actually the patient loses the control of the movement of half of the face, called Bell's palsy. Bell's palsy. And it's really usually those cases actually has a highly percentage of recovery with the therapy, etc., and the exercise. Sometimes you ask the patient to perform some. Okay, I'm just gonna read a little bit of the origin and insertion. I'm not, of course, like, if you can memorize them, that would be great. But just the most important one or the most famous one, and the whole idea from knowing the origin, insertion, and muscle action. What was really important would be the muscle action. I think usually there is a lot of question about only the muscle action. Origin insertion is very it's not a lot, but usually they try to test your understanding of the bone attachment or the muscle, how the muscle actually attached to the bone. Based on that, actually, you can even expect the muscle action if you really understand the bone. That's why I keep repeating 1,000 times before, as you know, from the beginning of the semester, that knowing the bone is very important. So if you still have problem with the bones, please go and review them. So let's say the epicranius, okay, the occipital bone, the origin will be the occipital bone, the occipital bone at the back of the skull, and the glea aponeurotica, this highway reaching between the frontal belly and the occipital belly. Incision will be the skin of the eye boros and the glea aponeurotica as well. And action will be raises eyebrows and retract the scalp. And of course, all these muscles like actually innervated by the facial nerve. So it's easy now, facial nerve. That's why when someone has paralysis at the half of the face, that's because of inflammation or some problem with the facial nerve. Okay. So let's take for example orbicularis oculi muscle, orbicularis orbit, muscle surrounding your eye. And this is your eyes here. So this is actually the muscle surrounding your eye. And the origin will be the maxillary and frontal bones. You know what is the maxilla, of course. So if you don't know, review the facial bone and the frontal bones. Okay, frontal bones of the skull. You know how many bones in the skull now? Frontal, occipital, to parietal, to temporal, and now sphenoid and ethmoid bone, plus the facial bone, of course. And the insertion will be the skin around the eye. So insertion of this will be skin around the eye. What the muscle action? Closes eye as blinking. Closes eyes as in blinking. Okay. Of course, I'm not gonna read all of this for you, but usually when you read this and you find yourself very comfortable locating the origin and insertion, I want you to focus on muscle action, very important. But if you find yourself comfortable reading origin and insertion, that's mean you did a great job. Yeah, so this is will be lateral trigoid muscle, lateral. So from the law, we explain in the first time in the anatomy, if there is lateral, you expect medial right away, okay? Anterior, expect posterior. Superior, expect inferior. Major, expect minor. This all the time like this. And muscles and bones, okay? So lateral trigoid at the side here, at the end of the mandible, attachment. This will be the mandible bone, okay? And this is the medial trigoid. This is very important for muscle of mastication. When you grind the food, lateral and medial trigoid along with the masseter perform grinding the food. Okay. Okay, this is the muscle of mastications. Again, without those muscles, you cannot actually break down the food. How you break down the food? You break down the food mechanically and chemically in your mouth. So mechanically, you have to move the muscle. So what the name of the muscle responsible for that would be the masseter Okay, the masseter, what is the origin? Be the lower border of zygomatic arch. Insertion will be the lateral surface of mandible. Action, elevate mandible and closes the jaw. Elevate mandible and closes the jaw. Again, it's easy that the innervation will be trigeminal. Tri mean three, the nerve with the three branches. So trigeminal nerve actually supply or control these muscles, muscle of mastication. Temporalis, again, you see is temporal bone, and you add lis, that's mean muscle that cover the temporal bones. Temporal bone will be the origin. Incision will be the chronoid process and anterior ramus of mandible. And the action will be elevate and retract mandible and closes the jaw. Okay, lateral pterygoid and medial pterygoid. They love to ask you the question to confuse you, okay, about the medial and lateral. The lateral pterygoid depresses and protract mandible and move it from side to side as when grinding food. Okay, both move it from side to side, but this one protract the mandible, protracted. But here, this medial pterygoid elevates the mandible. It elevates the mandible. Just you gotta know this. Elevates the mandible and move it side to side. So moves it from side to side as when grinding. Both perform this action, lateral and medial pterygoid. But the difference is lateral pterygoid depresses and protract. Medial elevate. Okay, so remember this. Medial ME, E elevate. Okay, no this term. Okay, so sternocleidomastoid muscle coming from sternum, clavicle, and go to the mastoid process. Okay, and the trapezius again, see, looks like trapezoid, and this is a muscle actually that cover this big beautiful, looks like trapezium muscle at the back of your. Now this is the muscle, show you the lateral view of the sternocleidomastoid again. This is very important muscle because usually a lot of people has this problem. You wake up in the morning, you cannot turn your head right or left, sometimes to the left side, sometimes to the right side, because of muscle, severe muscle spasm in this beautiful muscle. Okay, and this is the splenius capitis muscle again. And this muscle here called the scalens muscle actually important too. You have anterior, medial, and posterior. And this will be the trapezius muscle. And of course, this is a clavicle. We're gonna talk more about this. See this anterior view here? This is the atlas. So atlas, which is the cervical number one, the vertebra cervical number one. They call it atlas because on the top of it, the brain and the brain consider are the entire world. So they holding the entire world in the top above this level, which is your brain. As you can see here, this is a transverse process of C2 and C7. If this is C1, this is 2, 3, 4, 5, 6, C6, right? Just to show you, this is a thoracic T1 or thoracic vertebra number one right here. You see this nice disc between these vertebrae. We'll talk about it maybe later. Very beautiful design. And this is actually what makes you flexible. If you don't have those discs, you won't be able to bend or rotate your trunk or anything. This is the anterior scalene, as we spoke about before. I mentioned the previous slides. And this is the anterior one. And this is the middle scalenes. And this is the posterior scalenes. I'm sorry. Keep just confusing the name, sorry. So this is posterior scalene. This is just to show you the origin and insertion of both. So as you can see, the anterior one taken from the second transverse process of the second cervical, third cervical, fourth, fifth, and sixth, and all insert in the first rib here laterally. Same thing with the medial. Medial is taken from the second and the third and go to first rib as well. The middle scalenes I took from the middle one and goes to the second rib here, lateral border of the second rib. Okay, this to show you the internal intercostal muscle. Internal, that's mean inside. If you have internal, you expect what? External. So this one external, which is the outside. Internal will be the internal layer. And this is the intercostal, mean between ribs. Intercostal between ribs, like interstate parkway between states. This is intercostal. This is between muscle between the ribs. Sternocleidomastoid, origin will be the mandiburum of sternum and the medial clavicle. So sternocleido. And the insertion will be the mastoid process of the temporal bone. We mentioned mastoid meaning breast in Latin language. This will be the side process of the mandible, of the temporal bone, I'm sorry. And the action will be flexes the head and neck and rotate the head right and left. That's why when you wake up in the morning, sometimes you couldn't turn your head right or left. That's because of severe muscle spasm at the sternocleidomastoid muscle. And the innervation will be at the accessory nerve, spinal nerve C2 to C4. Although you're going to study these nerve in detail properly next semester, you know the brachial plexus and the different kind of nerve roots. So usually you'll understand this more when you study the nerve or the nervous system next semester at Bio 160. Trapezius superior part will be the occipital bone and spinous process of C7 and several thoracic bone vertebrae. Insertion will be the clavicle and the spine and acromion of the scapula. Spine and acromion of the scapula. What the muscle action? Extend the head as a synergist. Synergist, the co-pilot, the muscle that help the prime mover or the agonist muscle to perform the action. Primary action on the scapula are covered in another lab. That will be probably the next lab. Okay. Scalenis, again, the anterior, middle, and posterior. The origin will be transverse process from C2 to C6 cervical vertebrae, and the insertion will be ribs 1 and 2, as we saw in the previous slides. The function will be elevate ribs 1 and 2, flexion and rotation of the neck when rib 1 is fixed. Okay, splenius capitis, spinous process from C7 to T6. And the insertion will be mastoid process and occipital bone, and actually it's extend the head and rotate the head. From origin and insertion, and sometimes from the name of the muscle, you can expect actually the muscle action. So muscle action is very important. Okay, semispinalis capitis, the half muscle that cover the spine. The origin will be the processes of inferior cervical and superior thoracic vertebrae. Processes of inferior cervical and superior thoracic vertebrae, and the insertion will be the occipital bone. So if you have actually muscle attached to the occipital bone, what the action will be? Extend the head and rotate the head as well. The muscle action as well. Okay, I don't want you to get intimidated with this image here or slides. I just want to show you the names. Although this muscle very important, but I know some of you get really confused a lot because of the names, but it's very easy to know. This is the hyoid bone. Remember the hyoid bone we spoke about, this one here. This is the only bone that must not attach to another bone, right? The hyoid bone. So you have now to know the name of the muscle base in the hyoid bone. This will be the right side. Of course, this will be the left side. So this will be the superficial, this will be the deep. So in the superficial, you have two. You have suprahyoid muscle. So if you have suprahyoid, you expect what? You have infrahyoid muscle. Okay, so we have supraoid muscle and we have infraoid muscle. And okay, so supraoid, you have the digastric, it's anterior belly and posterior belly, digastric, and you have the styloid, and myloid. Okay, here in the infraoid muscle superficially, you're gonna find sternoid. That's from the name, coming from the sternum, go to the hyoid bone. This is the hyoid bone, and this is a sternum in the back here. This is the sternum. All this will be the sternum. Okay. And omoid have superior belly and inferior belly. And of course, this is the larynx, famous larynx. These muscles actually control a lot of the voice, etc. Okay. And of course, what cover all this muscles will be the platysma. Remember the platysma in the first slide? Okay, now the deep layer, you have thyroid. You remember everyone have problem with the thyroid gland. This is the thyroid bone. Okay, this is the sternothyroid. The sternum mean coming from the sternum here, going all the way to hyoid bone here. So sternoid, and both actually make the deep infraoid muscle. So just know the name. We have supraoid muscle and we have infraoid muscle in the superficial layer, and we have deep infraoid muscle. The deep is actually very easy. You have the thyroid and the sternothyroid muscle. What the muscle function actually right here, that will be the digastric, the two part. Origin will be the inferior mandible, anterior belly, and mastoid process will be the posterior belly. So in the inferior mandible, you have the anterior belly origin, and in the mastoid process, you have the posterior belly, and the insertion will be the hyoid bone, of course. You know the hyoid bone, the only bone that does not attach to another bone in the skeleton. Very important bone. Control, like help with the swallowing, holding the vocal cord, a lot of things. It's open mouth. Okay, and depresses mandible, elevate hyoid bone. This actually help you with the speaking. As I speak now, this helped me a lot. And the innervation will be the facial nerve, and posterior will be the trigeminal nerve. Okay, styloid muscle, I'm sorry. It's styloid process of temporal bone. And of course, as you can see, all the insertion will be at the hyoid bone. Okay, except the sternoid have the thyroid cartilage of larynx. But all of them actually insertion will be the hyoid bone. So it's easy to know the insertion. So myloid, the origin will be mandible, insertion hyoid bone, and elevates hyoid bone during swallowing. So it helps with talking, swallowing, and everything. This styloid here retract and elevate mandible, hyoid bone, I'm sorry. The myloid elevate hyoid bone during swallowing. Sternoid origin will be the mandibulum and medial clavicle, and insertion will be the hyoid bone. Depresses the hyoid bone. Omoid, the two parts, superior border of the scapula, and insertion will be the hyoid bone, and depresses the hyoid bone again. Sternoid, origin will be the mandibulum, and insertion thyroid cartilage of the larynx. This is the only exception here. So the sternothyroid muscle coming from sternum go to the hyoid bone. This actually the insertion will be thyroid cartilage of larynx. So it's easy to remember, thyroid cartilage of larynx. That's it. All the other bone insertion will be an hyoid bone, and it depresses the larynx. Thyroid cartilage of the larynx. See, you can always do the crossover like this. Thyroid cartilage of larynx, and insertion will be the hyoid bone. Muscle action will be depresses hyoid bone, elevate larynx.